my name is Casey Flanagan. I'm a heart failure and transplant cardiologist at the Inova Heart and Vascular Institute. I'm board certified in 3 separate things: in internal medicine, and in cardiovascular disease, and in the actual practice of heart failure and transplant. And taking care of the sickest of the sick patients, particularly in the cardiac intensive care unit, requires me to utilize skills learned in all 3 of those training sessions. The philosophy is really dictated by the individual patient, what their wants and what their needs are. I think the cornerstone to any good therapeutic relationship with a patient is how you interact with that patient. And I think that comes down to transparency and honesty. It's important to establish an understanding of the disease process for the patient. So the first step in our therapeutic relationship is educational, to make sure they understand why their heart is doing what it is. The first question they often ask me is, what caused this? And so the next step in the process is to try to determine what's the underlying etiology. Why is their heart functioning the way it is? The third step would be focused on what treatment options are available to them, and the fourth is what treatment options are they interested in and which ones are they not interested in. In most ICUs, patients are cared for by one doctor and then specialists consult on that patient. They use a different model in Inova, and it's a model that results in, I think, more comprehensive embedded patient care. You'll have a cardiologist and a critical care doctor working together to provide the most comprehensive care for the patient. When looking for a job, Inova offered the best of all worlds. And by that I mean it allowed me to challenge myself taking care of the sickest patients, to work in a healthcare system where collaboration is valued over individualism, and to work in a hospital system that allows us to educate the next generation of healthcare providers while performing cutting-edge research. I think the biggest compliment that a physician can receive is having a patient or family member come up to you months after you've cared for them, hug you and say, "Thank you for saving my life." My name is Casey Flanagan, and I'd be honored to be a member of your cardiology care team.